66 years male complains of the severe pain for 4 years and right more than left claudication distance is limited to home, 5 minutes standing time, more than 5 minutes he is not able to stand, severe pain, claudication, scoliosis, bladder bound involvement is not there at present. He is non-diabetic but hypertensive and for last 4 years he is under the treatment, all conservative treatment now exhausted, not able to sleep properly due to pain. Now the MRI shows severe lumbar canal stenosis at 2 level 3, 4, 4, 5. Now we are approaching the 3, 4 level first. This is the 3, 4 level. This is the L3 lamina, L4 lamina facet joint and the spinous process. So cranial, caudal, midline and lateral. This is the right approach, L3-L4. We are trying to detach the flavum cranially from the L3 lamina or superior lamina. tilt करो टेबल से फोटो उठिए और गुड उठिए तो now ligamentum flavum, the deep layer is detached cranially. We are going laterally now. This is the facet. The medial aspect, there is a hypertrophic portion. These are the osteophytes, huge osteophyte. This is spatula, sorry, 45. So the facet is very much hypertrophied. The portion of the facet, the medial aspect hypertrophic portion, that we have to remove so that the otherwise the normal will be not able to decompress. 45. The facet is here, this person. Now I am trying to demarcate the subtissue bone attachment site of the inferior lamina. the medial aspect of the hypertrophic facet. Now the dura is visible. Petty. To protect our dura, we'll put a petty. Then we'll proceed. Petty. Now we'll put another petty cranially also. This is the deep layer of the ligamentum flavum. There, 45. Patient is 66 years, lot of hypertrophy, medial facet. So we are tracing the nerve root up to the foramen, foraminotomy, and nerve root decompression up to the foramen. check are you able to put the patty at the shoulder of the nerve root or not. Yes. So this is my disc here. Disc cursor. Disc cursor. Patty. Right. Now we are putting the caudal patty enter to the nerve root. The nerve root is post medially. We got sufficient space laterally to disc. Remove the disc coming. There. चूल्हा चश्मा लगेले देखा तो यहाँ स्पाइनल कॉर्ड एदर बाहर नर्व ये जो धड़ा ग्लिसरिन स्ट्रक्चर से गोड़ को जाऊँगी तले डिस्क अच्छे यहाँ बाहरी आसिक चिपुच डिस्क Now we'll go to inside the disk space and see if there is any left out fragment or not. Nothing is inside. Very nicely cleaned. All the fragments removed from the L3-L4 level now. So this is the right approach. Yes. Now we'll irrigate the disk space with normal saline and gentamicin. So if there will be any small tiny fragment also, it will be pushed out with the help of the pressure of the saline. This first. Spatula. ଏଇଟା ହେଲା ଡୋରା ଏଇଟା ଧକ୍ ଧକ୍ ହେଉଛି ଯେଉଁଟା ସ୍ପାଇନାଲ୍ କର୍ଡ଼ ଯେଟା ତା ଦେହରୁ ବାହାରିଛି ନର୍ଭଟା ଏଇଟା ଦେଖିପାରିଲେ ଏ ନର୍ଭଟା ଏଇଟା ହେଉଛି ଗୋଡ଼କୁ ଯାଇଛି ଦିସ୍ ଇଜ୍ ଦ ନର୍ଭ ନାଉ ଇଟ୍ ଇଜ୍ ଫ୍ରି ଆଣ୍ଡ ମୋବାଇଲ୍ ପୁରା ରିଲାକ୍ସ ହେଇଗଲା ଆଉ ତା ଉପରେ କିଛି ପ୍ରେସର୍ ନାହିଁ ଦିସ୍ ପର୍ସନ୍ these are the petty we have given to control the bleeding and push the nerve root and the cord medially. चलो थैंक यू ये गला था काम हाँ चलो देख पेटी हाँ जा था So now we'll go to midline. We have done the decompression of the nerve root, foraminotomy of the right side, done the discectomy also. This is my midline. Now we'll decompress the midline structures, meaning a bit of the under surface or undercut hanging of the midline structures. So now we have crossed the midline, so we are going to the opposite side, repositioning our petty at the opposite side. We will try to put the nerve at the shoulder of the nerve root, the petty, cranial petty, in my caudal petty, very tight canal. So hypertrophic portions of the ligamentum flavum of the opposite side. These are the hypertrophic portions of the opposite side lamina, the discs. Now we are on the opposite side. This foramen. Now let's see if you can assess the foramen or not. Yes. So there is my nerve root and this process. Very tight canal. Now we have changed the PT, taken a new one, putting that shoulder of the nerve root. Very tight. And this is my nerve root here. One on there. Putting the shoulder of the nerve root. This is the disc face. Disc. This is the disc material here. This is the disc one. And so it protects the nerve with the angle of the kerison, and then now the nerve root is completely decompressed up to the foramen. You can see the nerve root very nicely. Photo. Yes. There is the disc of the opposite side, not so big, small disc. There. टेबल सीधा करो, मॉड बिल्ड करो। ठीक है, चलो so one level discectomy with the over the top bilateral decompression done. Now we'll go to the another level, that is the L4-L5. L3-L4 is just finished. This is a right approach. We are planning to L4-L5 also from the right approach again. The patient complains from the right, more on the right side. चलो स्टॉप कर जल्दी कर The same 66 years male complains of the right radiculopathy for last 4 years, aggravated for last 3 months. All conservative treatment exhausted. Now he is limping, scoliosis, pain, hypertensive, non-diabetic, walking distance limited to home, few steps, severe pain. So both the level L4, L5, L5S1, severe LCS, and now the L3, L4, LCS with the disc, L3, L4 bilateral decompression over the top, and we have removed the disc also from the right side, right approach. In the L4, L5, this is the spinous process, this is the superior lamina, inferior lamina, facet, and this is the spinous process here. So midline, cranial, caudal, lateral. We are approaching from the right side. L4, L5, L3, L4 already done the job, bilateral decompression and discectomy. Now the ligamentum flavum is detaching cranially. Cranially it is from the superior lamina. Now we are going laterally to the lateral aspect of the lamina, medial aspect of the lamina, and this is the SAP, the superior articular process of the inferior vertebra. Here it is the L5 vertebra. This is hypertrophic, so we have to remove the hypertrophic portions of the SAP. Very, these are osteophytes. Now we'll go for the inferior lamina and we'll check the demarcation of the soft tissue to the bone attachment. These are the superior layer, the superficial layer of the flavum. The yellow ligament looks very nice, yellow structure. Now we'll go to the deep layer, and we will see the demarcation of the attachment of the deep layer to the bone here, very nicely cleared. Now we'll try to detach the deep layer from the inferior lamina. Very tight canal, there is no space. Now these are the hypertrophic portions of the bone. Yes, petty. Now go to the label, and to protect the dura, we'll put our petty. So there we are in the safe side, 45. These are the hypertrophic portions of the bone at the facet. So that's why the foramen. So the foramen tummy is required to decompress the nerve root. There's a lot of hypertrophic bone here. The hypertrophic bone and the facet ligamentum flavum. This not completely detached from the cranial aspect, from the superior lamina, 45. Now we put a petty to protect our dura and to see the level where we are. ये opposite कलू रे
और वो क्लिक करो तो
था only this person. Now we're going to midline. 30, 45, this process 30. You can see the pulsation very nicely, the dural pulsation, very tight canal. We are going to the opposite side now, the 45. This actually, so we'll try to reposition pretty maybe at the shoulder of the nerve root. Let's see where. Very tight canal. Yeah, nerve root is here. So, yeah. Have to be careful here because below this structure is the nerve is there. Yes, now nerve root is visible. There is a nerve. Yes. Now the shoulder of the nerve root is clear. To 3 mm tension is tight, not able to work properly. So I'm taking now 2 mm tension instead of 3 mm. Now this process. Now we have seen the shoulder of the nerve root, and now we'll try to put that petty at the shoulder of the nerve root. Yes. Now we need the 2 mm because we are not able to work due to tight canal. My nerve root here. Now my Terison angle is protecting and pushing me my nerve root medially. I am going to the foramen now. This is the foramenotomy, yes, with a nice bone, the deroofing of the foramen. Yes, so these are the foramenotomy done, the deroofing of the foramen. You can see the bone pieces. Now my Terison is angle is protecting, and I am taking the bite. Yes. Photo, spatula. Yes. And this is my disc of the opposite side. This is the opposite side disc, but it is not so big, the small one. It is not protruded. Little bulbing was there. So done the opposite side. Now we'll come to the same side or the right side. Petty. The tilt table. Two. Now we'll try to see the right side nerve root. Where? Let's see. Impossible. So we'll put the petty at the shoulder of the nerve root. Our petty. Now we'll put another petty at the foramen. I've done the partial foramenotomy here in the right side. Yes. So this is my nerve root here. Oh, nerve root is here, somewhere here. So again deep. So okay. The hypertrophic portion of the ligamentum flavum, and below it is the nerve root. So you have to be careful here. These are the hypertrophic portions of the bone, the medial aspect of the facet. Yes. Now this is the nerve is visible. There is a nerve. So sometimes if you misinterpret the location of the nerve, that may be the disaster. So you have to very careful, slow, steady. lot of osteophytes are here, disc forceps. Now very nicely decompress the nerve root. So disc forceps. So that is the confusion came now the disc, sorry, spatula. I was thinking this is the nerve. Actually, this is the nerve, and another nerve is here. So this is the confusion. Maybe sometime it comes as a conjoined nerve like this. So I will try to put a small pity here at the shoulder of the nerve root. Let's see if possible it is good. Yes. Now this person. Spatula. Yes. Now 90. So the demarcation between the deep layer of the ligamentum flavum and the nerve root is now clear. I am taking the 90 carry sequence, 90 degrees, sorry, 90 mm, 90 degree instead of 45. 90 is for the soft tissue and very sharp. So you have to be careful. Only under vision you should put it. I am still not able to see the lateral aspect of the shoulder of the nerve root. Yeah, 2 mm, because it's a very tight canal. The soft tissue is adherent, almost very tightly adherent to the root, and these are my bones which is coming on my way. So for my trajectory only, yes. That. Yes, now very nice bite at the shoulder of the nerve root. Nice, 45. So now free, mobile, and decompress the whole of the nerve root. 90. Hmm. Nice bite. Now 22 mm. The spatula. So I think it is done now very nicely. Yes, this is all good. We are the shoulder, freely mobile, everything is finished, fine. 2 mm. What to do? Now this cursor was chalo. This is the tangent nerve, you can see very nicely. Spatula. Okay. Chalo. Was. There. There. Spatula there.